Hi everybody, Jenny Sprung, treatyourselfnaturally.com. I'm a neurosomatic massage therapist, a zero balancer. I do a lot of work with the cranium, the head, the eyes, the jaw, the viscera, along with a lot of do-it-yourself pain relief videos and articles and posts on my website. Please come and visit. I appreciate it. I would like to talk to you now about decreasing tight, sore, tender areas in the head, the cranium, and the eyes. These are very simple, easy, do-it-yourself options that you can use anytime. You've probably already used some of them, but let's work together. I'm going to do the first segment lying down, so you'll only see one side of the face, then I'm going to sit up and show you the rest. So I would like you to do this lying down. You can do it seated, but I'd like you to do it lying down. So the first thing I'd like you to do is just feel your head. So you're going to breathe deep, inhale, exhale, make sure that you're relaxed. The knees can be up or they can be down. And just feel your cranium, the interdigitation of all of the cranial bones. Feel the frontal bone, feel the temporal bone, frontal bone, temporal bone, parietals, and occiput. And see if you can just wrap your hand all the way around the skull, and you're just going to squeeze. And pull, you're going to pull and do skin roll and pull the fascia. Take deep breaths, inhale and exhale, and continue to pull the fascia, all through the interdigitation of the cranium. Feel where tight, sore spots might be, and work those. You can open and close your jaw at any time you feel that a stretch may be effective. We are using 2 to 3 pounds of pressure, and we're warming the fascia that surrounds the skull, the fascia that surrounds the muscles in the head, face, and eyes. Very simple. The next thing I'd like you to do is to just grab your eyebrows and just pinch the eyebrows right between your fingers. Just pinch the eyebrows. And then run your hands up through the orbital ridge, just right up into the ridge, and there you'll find some sinus points. You may even feel referrals of headaches you've had or eye aches. Hold those points 8 to 12 seconds. Deep inhale and an even deeper exhale. So once again, fascia around the cranium. Find tight spots and pull. Open the jaw. Grab the eyebrows. And then the orbital ridge. Then you can pull the nose, the skin on the nose, and squeeze it. Pull it really tight, or you can press it. It might even make you sneeze. You'll feel the cartilage. You can go into that a little bit and move the nose around. Bring your hands down and come into the sinus point. Right on either side of the nose. Hold that for 8 to 12 seconds and you can just feel the tension melt away. Next, you can do some skin rolling. So the best way for me to show it to you lying down is this way. You're just going to skin roll all the way down to the clavicle, all along the temporomandibular joint, external skin rolling. You can reach up underneath your jaw and release all of the muscles there. Just place one finger under each line of the mandible. And squeeze there. Nice deep breaths. 1, 2, or 3 times. Then you can pull your ears and open your jaw. You might hear clicks and pop. You can pull your ears, you can twist your ears, and you can grab your ears. Move them around. There's muscles that hold them in place that can get really tight. So work all behind the ear. You can even pull the ear and rub all of the fascia behind the ear. So pull the ear across and just rub the fascia behind the ears. Back behind here is also some attachments of some upper back and neck muscles. You can push into those and just stretch the fascia all the way up. Then you can go into the hair and pull the hair. And that is exquisite. Just give the hair a lot of pulls. How do you pull the hair? Well, the hair, this is not grabbing the ends and pulling it like this. This is reaching your hand right next to the skull, reaching in and holding it and pulling it. And as you pull, you can open and close the jaw, and then you can twist. Take a deep breath. Feel the release. And last is the temporalis. And I'm going to sit up and begin this sequence again so you can see it. The temporalis is here, and you're just going to stretch the fascia up. And you can start with the fascia right at the jawbone and move all the way up. You can go slow or fast. Come up underneath the hairline, grab the hair and pull the hair, and slowly pull the arms apart and stretch the jaw. So let's review again. We're using scooping. We're scooping fascia. We're not pressing hard. We're using gentle, do-it-yourself manual manipulation to reduce headaches, temporomandibular joint, neck pain, face pain, whiplash pain, trauma. So many things can be reduced by touch and your own touch. The first thing again is to locate the sinus points. So grab your eyebrows and pull. Just pull your eyebrows. Go up into the orbital ridge and run across the orbital ridge, and you'll feel the sinus points right in here. Beautiful. You can go into the nose and just pull it, squeeze it, twist it, move it around. Go into the fascia, and there's some more sinus points on either side of the nose. It's much better to do this lying down, but you probably can see it better with me seated. And then you can do skin rolls. You're going to start right here, and see, this is much easier for me to grab the skin on this side, so I'm going to do this side down. I'm going to grab the skin and roll. Oh my goodness, here's a spot. When you find a spot like this, hold it and roll it back and forth so it's like this. And just roll all the way down, all the way down. Gently stretching the skin rolling, the platysma. And then you can feel this warming up all of the fascia. Hair pulling, again, anywhere you can. And if you're follically challenged, if you don't have any hair on your head, just reach in and move the skin across the skull. Really, just this kind of movement and squeezing and pulling. and push it together too. You can really just push. Big breaths, inhale, exhale. You can squeeze your head and release it. Anytime you feel the need to open the jaw and stretch it, go ahead. You can pull the fascia up, grab the hair, and open the jaw. Twist a little bit. Yeah. Nice deep breaths. You can do a little bit of your 8 neck stretches. Bobblehead, little Egyptian. And then lastly, you can ear pull. So you're going to pull the ears, reach your fingers all the way in and pull. Pull them down, twist them around. Do this almost every day in my practice. The ears are very sensitive, but they really do a lot of release. There's a huge amount of release, huge amount of release. Excellent. There's a couple of videos that accompany this, and then one is the temporomandibular joint video, and the other is the neck, the anterior and posterior neck. And there's videos for the shoulder, there's videos for the viscera, the vital organs. Vital organs and some of the other videos are beginner videos. There'll be intermediate videos coming in a few weeks. I want everyone to start off slow. So there you have it. Whew, everything is nice and warm, everything is pink, blood is flowing, feels great. Don't forget your temporalis. Oh, good. Always want to really work that. That's a huge muscle. And on my website there's an article with all of the anatomical parts, structures, and this is not an anatomy class. This is just for you to be able to locate them safely and to know where you're going and to learn a little bit. Thank you very much. I'm Jenny Sprung, treatyourselfnaturally.com, and I'll see you next for temporomandibular joint.